Public Report, a public affairs presentation of KTVW. The opinions expressed in this program does not necessarily reflect the views of the Trinity Broadcasting Network.
Hi, welcome to Public Report. I'm Tanny Jackson, and today our topic is on youth. And we're talking about depression, cuttings, suicide. And with me in the studio today my guest is Diane Buford, Certified Counselor of New Life Counseling Services, PLLC. Welcome, Diane.
Hi, glad to be here.
I'm glad to have you. I have a lot of questions for you.
Good, good.
My first one, can you please give me some background on yourself?
Sure. My name is Diane Buford. Like you mentioned, I'm the owner of New Life Counseling Services, PLLC, here locally. I have an office in Auburn, Washington, and also an office in downtown Seattle. I work with family members, marital counseling. I specialize in adolescent counseling and adult counseling services, as well as life coaching and various testing and parenting plans.
So you're the founder?
Yes.
Oh, okay. And you work with a lot of children with depression.
Yes.
Where does that begin?
Depression begins it could happen from lack of doing well in school. It could be because of bullying. It could be because the parents are getting divorced, lots of fighting at home. It could be because of low self-esteem. It starts because the child doesn't know how to express themselves verbally. They don't understand their emotions. They lack emotional awareness. So instead of externalizing what's going on the inside, they may keep it in. They may not share it with people or not know how to share it. And so they'll do things like isolate, they'll have defiant behavior, they'll get angry in outbursts, they won't listen to their parents anymore, they'll lose interest in things that they liked doing before, sports or video games or anything. They'll lose interest in that. They might find a new group of friends that gets into trouble or not so good to hang around with. So there's different things that are leading to depression in adolescence.
And some of the things you just discussed are some of the signs: isolation, getting away. Are there movies or different things that they just kind of they're drawn toward? Or? They'll
stay in their room. If they were very social before and their friends are calling and you notice they're not coming around anymore. Teenagers aren't like adults, where adults, when they isolate, they stay only to themselves. What a teenager does is they may stay with only one person or two if they were someone who's extremely social before, or if they isolate, they'll isolate from family. They won't want to eat dinner with them anymore. They'll always stay in their room. If people go knock on their door, they'll yell at them and tell them to go away. They don't want to be bothered. And then, so that's a way that teenagers isolate. It's different than adults.
So they don't want to talk about it. What about cutting? What is cutting?
Cutting is a form of self-harm teenagers generally will do to release stress and anxiety. What they'll do is they start off by scratching, maybe a small scratch. It might be deeper. They might draw blood. There's other ways of self-harming themselves. They can bang their head against a table, throw their whole entire body against a wall. They can do reckless driving. They can have unprotected sex. They can do various things of self-harm, drink poisonous liquids. So it's not just cutting as far as self-harm is concerned, but anything that harms them physically is a symptom of what's going on inside emotionally, and they don't know how to deal with it.
Self-cutting, you can see that there are notable marks.
They generally hide it. So if you're sitting with your teenager and you're sitting at the dinner table, and let's say they're wearing long sleeves like you wouldn't notice it.
So basically they're cutting.
They'll cut here on their arms, they'll cut their chest, they'll cut their legs. They'll do it in areas where people can't see, because with cutting comes fear and shame and guilt. And so a lot of times they're not doing it for attention. They're doing it because, again, they're hurting on the inside. They're emotionally in turmoil, and they don't know how to deal with it. So it's a form of release, and it gives satisfaction for the moment, takes their mind off what's going on. But the thing about it is it only lasts for a minute, and once they do it, it becomes a ritual, and once it becomes a ritual, it becomes a compulsion, and then it's almost like an addiction. They can't stop. So that's when it should be really nipped in the bud, because it can, lead to other things. Depression, it'll lead to depression because now there's that guilt and shame. They can't talk about it, can't share their feelings with anybody, so now they're internalizing everything, and then it leads them deeper and deeper into depression, which can progressively get worse into suicide and other things.
So how prevalent is cutting?
It's in most high schools and middle schools today.
Really?
Yeah.
Okay, so just thinking about the cutting part of it, parents, how can you alert a parent that this is happening with their child? What can you say? What signs do they look, if they hide the cutting, what signs can they look for?
If a child is cutting and you don't actually see it, it's kind of hard to detect. So
it can be very dangerous.
Yes, exactly, because again, they're hiding it. They're not going to be out in the open. But if you notice behavioral changes, they might start doing drugs and alcohol. They might be defiant. They might be angry, agitated. Again, those are signs of depression, but usually those are signs of cutting as well. If you have a suspicion, even the littlest inkling, it's always vital to sit down and try to talk to them, or take them to a professional, a therapist, a counselor, their physician, the family doctor, and do a depression screening with them just to make sure there's no other physical things going on. But they will, again, they'll start to complain of being having fatigue, being tired, lack of energy, sore muscles, and these are physical outward expressions of what's happening on the inside. So these are little cues that there's something not right with your child.
So how prevalent is suicide?
It's not like it happens as much as cutting, but it's out there, and it happens. And it happens at an alarming rate. It's just not as talked about. It's one of those taboo subjects. If we don't talk about it, then they won't.
We'll go away.
Yeah, or they won't think. If they're not thinking about it, and we do talk about it, then I'll plant the thought in their mind, and then they'll do it. That's a lot of the myths that are out there. So parents are reluctant to talk to their teens about suicide, but the more they talk about it, the less likely their child is to do it. And the more their child will know that they're not alone, and that somebody actually cares about what they're going through. And it'll help them express their emotions, so they'll know how to deal with and cope instead of holding it in or giving up.
So when they come to your office, the children are there, right? The youth are there. They come. Are they open about what they're going through? Do they share their heart?
Generally they do. It just depends on the parents. To be honest with you, if a parent is in the room and the parent is yelling or telling the kid, basically like preaching to the kid, or like criticizing the kid will shut down. They won't say nothing. They'll just sit there and they'll check out. They'll get on their phone, they'll stare at the wall. Generally what I do is I meet with the parents and the children the first session, just to kind of get a gauge of the family system, how it works, and then what I'll do is see the kid by themselves. The parents will be in the waiting room, and then they usually open up and spill all their beans, and then I know what's really going on, and then that's how we're able to deal with it.
So you're basically counseling the parent and the child?
Yeah, it's teaching the parents parenting skills subtly, and working with the teenager to open up and to use their words and to communicate effectively. And then I teach them how to communicate to each other, because a lot of times parents and children don't speak the same language. So
and that can be a big problem.
Yeah, because they want to talk to each other, they want to be able to communicate, but they don't know how. So I'll coach the child on how to communicate their feelings to their parents, to where their parents understand, and vice versa.
So do you find with talking to the parents that they begin to open up and share what they're going through? There's problems there, and it's kind of just flowing over into the child's life?
It's a family system is broken. So if the parents are fighting, the kids feel it. If the kids are fighting with the parents feel it, and so it's a family system thing. So really to get a good fix on it, you want to fix the system.
Where can they go for help, and where are you located? You have a website?
I do. My website is www.newlifecounselingservices.biz. My primary location is in Auburn at 903 East Main Street, Auburn 98002. And my telephone number is 253-269-0224.
So how can teachers get involved? Because schools is now in session, and I know that teachers see different things happening. How can a teacher spot a problem and get involved?
If the student was getting good grades and all of a sudden they don't care about their homework, they're ditching class, they're sick all the time, they're never there, those are good indications that there's something wrong. A lot of schools have school counselors on the premises, so what they can do is advise the child to go talk to the counselor in the school or notify the parents that there's something happening with their child.
That's good. So worst case scenario, what do you do? If the problem is not resolved and this child's still acting out and there's obviously thoughts of suicide?
You take them to get professional help. You take them to get therapy. And talk therapy, medicational therapy, whatever it takes to get them help. But they can't do this alone and they don't know how. So it's everybody's responsibility to take care of our kids.
And really just looking for the signs. Can you give a few more of the signs? Parent that might be wondering, because a big one for me was isolation. You know, for the child to just sit and read all day or stay off in their room, that's not okay. Just a few more of the signs.
Agitation, isolation, anger, let's see, some other signs that for depression or for
frustration, anxiety, are those some of the signs?
It depends for depression or for cutting.
Yeah, so it's
They're
different then. They're different, okay.
Yeah.
So depression, cutting, and suicide are 3 different signs.
They kind of mix to the same. They're a little bit of mixture, but I'll put it this way. Depression is the center, cutting and suicide are on the sides.
Okay.
So generally if you have depression, you'll either have cutting, suicide, or all three.
But the good news is there is help.
There totally is help. And so the first sign is acknowledging that there's a problem and talking about it and getting your child to open up and talk about it. And the more that they can express themselves and work out the emotions. Usually it's from a childhood trauma or something that happened to them and they don't even know it's there. So just talking about, and then emotional awareness. When you feel like cutting, what's going through your mind? What happened? What were your feelings associated? So then they can learn new ways of coping with the major intense feelings that they're having. So if they had a fight with their best friend, they were angry, and because they were angry, they cut. And so once they acknowledge, when I'm angry, I want to cut, so then the next time they become angry, they're more aware, now I want to cut, now let me find something else. There's things that they can do for children that are trying to overcome cutting. For instance, getting a red ink pen and instead of cutting, writing on the area where they would cut.
Thank you so much, Diane, for that. And thank you for joining us on Public Report.